publisher, and CEO of Foreign Policy.
Good afternoon, everyone. How are you? Very good. Welcome to a fantastic event that we're going to be hosting right now, From Risk to Resilience, with our partners at Foundation S and the Africa-Europe Foundation. We've got a lot of people here. I know many of you are kind of in the corner over there. You may want to filter over. I know it's difficult to do. Feel free to walk in front and do that if you want, so that you're not buried. There's a whole open space over on that side. I'm eager for you all to be able to see, and we'll give you a couple seconds to cycle through. You can come up front and walk through if you like. It's perfectly fine. Don't be shy. Very good. We'll just evenly space everyone out. So welcome both our in-person audience, all of you, as well as those who are chiming in online. This event is a action report launch event. There's actually a report that was put together by the Collective Mind S Climate and Health Council, Foundation S's Think and Do Tank. It's better than a think tank. They also do. They convene world-leading experts from industry, the academy, civil society, philanthropy, and government who are committed to improving global health through collective action. They actually just had what I understand was a very productive meeting in person, one of the several that they do over the course of the year. We're so happy to host them here. The report is entitled From Risk to Resilience, Unlocking Climate Financing for Local Health Adaptation, and you have a copy of it in your chairs. So have a look and review that. You also have a QR code postcard in your chair. Use that to link through and see all the speaker bios, and then you can learn more about the program and the agenda of what we'll be covering. So with that, I want to welcome my partner, Vanina, who really orchestrates this whole thing. This is the second time we're partnering on this event. We're so grateful to you. So please do join us for some remarks.
Thank you so much, Andrew. Thank you. Please welcome Vanina Laurent-Ledru, Director General of Foundation S.
I love the voice of God. Isn't it amazing? So everybody, welcome. Thank you again, Andrew and Foreign Policy, for the great partnership. I also want to thank the Africa-Europe Foundation, a fantastic partner that has helped gather all of us here today. So we come together as a group of scientists, policymakers, agenda setters, community advocates with one common goal, and that is to support those living on the front lines of the climate crisis. We all know that mitigation is highly needed and absolutely critical, but today we want to focus on adaptation. We want to focus on adaptation because with 3.5 billion people already living in highly vulnerable areas to climate change, this is not a future problem. It is happening now. Just close your eyes for a second and picture the husbands, wives, mothers, sisters, brothers who have lost a loved one during the Sahel floods just now, or during the Hajj pilgrimage in Saudi Arabia. Just this year alone, 2 billion people have been living with 30 days or more of extreme heat. Heat that is causing increasing health impacts. So this is what we're seeing now. We all see that the pace of the crisis is unfortunately outrunning adaptation efforts. We all see that there is not enough money being invested to reinforce the resilience of healthcare systems. There is only 5% of climate funding that is going to projects that promote or protect health. What we may not all see is that only 10% of this climate funding is actually reaching local communities. We think that communities are at the front and center of this, but this is not all doom and gloom, and I want to make sure that we also get outside this room energized. I want to remind everybody that since the last UN General Assembly, where we convened here last year, we have witnessed great progress. We've witnessed $1 billion commitment coming from the COP28. We witnessed the first World Health Organization declaration on climate and health. We witnessed great progress from many funders and many promoters of climate and health that are gathered here in this room. So thank you for that. we thought, okay, what else can we be doing and how can we move together? So we commissioned new research. And this research that is just out today is showing that 91% of global citizens want more action from their leaders on climate and health. And 9 out of 10 global citizens believe that more investment is needed to protect people from its effects. People are right. The local communities are not seeing the money coming fast enough. The global commitments that I've just alluded to need to be seen in practice now. So with this in mind, we convene our esteemed Climate and Health Council that Andrew was mentioning just met for the past 2 hours. And we've developed this report that you have on your chairs together with the Africa Europe Foundation. This report, you're going to think, yes, the 10th report of my week. Well, we want you to think about it not as a report. This is an actionable blueprint that is showing a path to fast-track flexible financing for communities. You will see in this report that there are spotlight boxes. Those boxes give you concrete illustrations of what is already happening in the communities, what is working. So please use it. You may not want to read the whole report, but just read the boxes and see what the communities are already doing. Now we have a start. Now we can find paths to channel these efforts and unlock the potential of locally led adaptation with your help. If we work together across the public and the private sector and the philanthropic sector, we believe that we can evolve funding models. So these solutions require a full systems approach. They require more health integrated planning. They require a lot of long-term thinking. Yes, we know that. But at the same time, we can't let perfect be the enemy of the good. So with this in mind, I'm sure that our dialogue will inspire agency, action, and investment for the communities that we all serve, because it's time to adapt. It's time to turn action to get to hope. So thank you, and I have the pleasure of letting the great program continue with the voice of God, because I'm supposed not to speak. The voice of God is doing it for us. So thank you for this. Thank you for being here. Let's keep working together.
Now, please welcome Dr. Chelsea Clinton, Vice Chair of the Clinton Foundation and the Clinton Health Access Initiative.
Good morning, everyone. While you were referencing the voice of God, I was reflecting, where does that nomenclature come from? Who was the first announcer who decided to kind of deem themselves the voice of God? If any of you know the answer to that query, I would appreciate you sharing it with me and all of us. But on a more serious note, we at the Clinton Foundation, at the Clinton Health Access Initiative, are so grateful to be in this conversation with so many of you. We also know that we wouldn't be here without Andrew and the folks at Foreign Policy, without Vina and the folks at Foundation S. So incredibly thankful kind of for their energy and action to bring us all here together this morning. When I was at COP28 last year, I was so thrilled to be there for the first day that focused on climate and health. And while there was, I think, understandable mutterings about how it had taken, 28 COPs to have finally a day dedicated to health, and I see many of you nodding and recognize many friends in the audience, we decided that we would kind of orient ourselves on the gratitude of kind of the clear recognition of the interconnectivity of climate and health. And also, candidly, as Americans, the recognition that this affects us too. Rising heat isn't only someone else's challenge. Malaria now is no longer someone else's challenge. More extreme weather events occurring more frequently is not someone else's challenge. It's also a pedagogical challenge for those of us who are parents when our children read headlines like, why are once in 100-year storms happening every year? And so I share that just to say that we are partners in this work as kind of health advocates, climate change advocates, the recognition that we have to operate both, as Avina alluded to to ameliorate the effects of climate change in the future, while also, of course, doing what we can to prevent human suffering and protect lives and livelihoods today, but also very much for me personally as a parent. I want my children who are growing up here in New York City, and all of our children, to grow up in more hospitable, sustainable, durable, and equitable worlds. But we know that won't happen without the financing structures and the intentionality that is required to effectuate that, and to have people who are willing to have the courage to be first and the humility to be second, and to have the mentality that we will stay the course for the generation or generations ahead. And we can't do that without data. So really grateful for the launch of this report. We look forward at the Clinton Foundation to continue to partner with many of you, and hopefully to have new partners here too that will emerge as we kind of all recognize that we're in this together, but that we have to act collectively and urgently in both the present and the future. Thank you all so much, and now I'll wait also for the voice of God to announce who's next. Thank you.
Please welcome Audrey Duval, Executive Vice President of Corporate Affairs at Sanofi.
Good morning, everyone. It's my great pleasure to be with all of you this morning. I'm here today with two hats, as Executive Vice President Corporate Affairs at Sanofi, but also new member, thanks Vanina, of the board of our foundation, Foundation S. So it's a great honor for me, Vanina. In both capacities, of course, fostering health resilience is not just important, this is critical, and this is imperative to do it now. You mentioned also something important. 3.3 billion people live in highly vulnerable areas, where the death rate from extreme weather events in the last decade was 15 times higher than less vulnerable areas. But this is not just a humanitarian imperative. We also know that there is an economic return of $2 to $4 across developing countries for every $1 invested in health. And this is not enough well known. In 2023, Cyclone Freddy caused flooding in Malawi, displacing thousands of people and causing, of course, significant damage in health infrastructure and creating the perfect conditions for the spread, unfortunately, of cholera and typhoid. Even more recently in Chad, strong rains have caused flooding, affecting around 1.5 million people since July, with 18 health facilities being severely impacted. In countries that have experienced severe flooding over the last few months, displacing is worsening access to health services, disproportionately affecting vulnerable populations. And unfortunately, these external shocks are becoming less and less shocking, and a failure to address the resilience of health systems means we only see more of this devastation. Unfortunately as well, we know that to truly build resilient health system, we must come together across sectors and disciplines, and each play of our part. What we do at Sanofi. At Sanofi, we are investing around 450 million for 2030 to minimize our environmental impact, and for our foundation, Foundation ACE, we have committed to an extra 40 million over the same period to strengthen locally led adaptation and health resilience programs for vulnerable communities impacted by climate change. This is a strong commitment we have made at Sanofi. Thank you. But real change, of course, doesn't come from individual actions as what we do at Sanofi. It is sparked by the collaboration, cooperation, and of course we can do more, and we can, of course, multiply our efforts to be much more than the sum of their parts. This is why I'm incredibly honored to introduce today this distinguished report that has been already mentioned, and you should all look at the boxes that you just mentioned, Vanina, because it's a big call for action. And this report, of course, it's a great achievements by the Collective Minds Climate and Health Council. So big congratulations and thanks a lot for the strong contribution. On top of that, I would like to say to conclude that for me, this is of course very important that we continue to work together to overcome barriers, to ensure finance which countries, you mentioned also the ratio that will go directly to the communities, and these communities need more. We also need to continue to work together and thank you again for being here today, because I know that you have plenty other opportunities to join plenty of meetings. So it's a strong commitment and a big honor for us to have you today. So let's continue to work together to foster greater health equity and health resilience. Thank you so much.
Please welcome Dr. Austin Demby, Minister of Health for Sierra Leone.
Well, thank you very much. I am here on behalf of the President of the Republic of Sierra Leone, His Excellency retired Brigadier Dr. Julius Maada Bio. Unfortunately, he couldn't be here today, so I am in his stead, and I'm going to read his speech verbatim. The CEO and publisher of the Foreign Policy, distinguished speakers, esteemed guests, partners in global development, ladies and gentlemen. I'm very pleased to join you today to discuss one of the most pressing challenges of our time, certainly one of the triple planetary crises: climate change and its profound impact on local health systems. The theme of today's forum, From Risk to Resilience, Unlocking Climate Financing for Local Health Adaptation, speaks directly to the climate need for action, collaboration, and innovation as we navigate this crisis. This is a timely global discussion, but one that allows me to focus on my country and the African continent. As a known fact, Sierra Leone is among the 10% of countries in the world that are most vulnerable to the adverse consequences of climate change, and presently one of the least able to cope with the effects. For Sierra Leone, climate change is not an abstract threat. It is a lived reality that is affecting every aspect of our development. Rising temperatures and sea levels, shifting rainfall patterns, and more frequent and severe floods are not only degrading our environment, but also undermining our healthcare systems, threatening food security, and exacerbating existing vulnerabilities. In all of these, and as you know, our contribution to this planetary crisis is negligible. In this context, for us, climate equity and justice are at the core of confronting the climate crisis. As a country, Sierra Leone has faced multiple health crises, including Ebola and the more recent global COVID-19 pandemic. We understand the direct link between environmental resilience and health outcomes. Communities on the front lines of climate change are often the same communities that are struggling with fragile health systems. For them, resilience is not just a goal, but a necessity for survival. Often they suffer in silence, since their localized environments' adverse impacts do not make the news. Yet despite this urgent need, there remains a critical gap in climate financing for local health adaptation. Global climate funds, whilst essential, often do not reach those who are most vulnerable, they tend to focus on large-scale projects, overlooking the localized interventions that can have immediate and sustained impacts. This is where we need a paradigm shift. We must ensure that climate financing becomes more accessible, flexible, and responsive to the needs of communities at the local level. As most of you may know, local health adaptation requires funding mechanisms that prioritize prevention, resilience building, and capacity strengthening. We must invest in health infrastructure that can withstand climate shocks, in early warning systems that detect climate-related health risks, and in community-based health programs that address both immediate and long-term needs. In Sierra Leone, we have developed a robust climate change adaptation plan intricately linked to our development agenda. The adaptation plan, inter alia, focused on building resilient health systems capable of withstanding the shocks and stresses of a changing climate, offers hope for a healthier and more secure future. I can boldly declare that Sierra Leone is committed to leading by example. My government is working tirelessly to integrate climate resilience into our health strategies, ensuring that our hospitals, clinics, and health workers are prepared for the challenges ahead. We are committed to strengthening our healthcare infrastructure, enhancing disease surveillance, and ensuring our health policies are climate responsive. But we cannot do this alone. We call on our global partners to join us in unlocking climate finances for the most vulnerable, not as a matter of charity, but as a matter of justice. Our plan and the ambitious goals we have set for ourselves require substantial financial resources. Unlocking climate finance is critical in turning our plans into action. Financial investments that directly support local health adaptation efforts are crucial to ensuring that our communities are equipped to manage the health impacts of climate change. This includes funding for infrastructure, capacity building, and innovative solutions tailored to our specific needs. Distinguished ladies and gentlemen, the case for Sierra Leone is illustrative of the case for Africa. The African continent as a whole has articulated clear expectations and strategies regarding climate adaptation. At the African Union, we have consistently advocated for increased climate financing, emphasizing adaptation. Africa bears a disproportionate burden of climate impacts despite the minimal contribution. It is only fair and just that we receive the necessary support to build resilience. Our expectations are clear. We seek equitable access to climate finances, focusing on adaptation that prioritizes the most vulnerable sectors, such as health. Africa's strategy emphasizes the importance of localizing adaptation efforts, ensuring that communities are at the forefront of decision-making and implementation. We call for the developed countries to honor their commitments and support Africa's adaptation efforts through accessible, predictable, and adequate financing. The time for incremental change is over. We need bold, transformative actions that recognize the inextricable link between climate change and human health. Together, we can move from risk resilience and build a future where every person, regardless of where they live, has access to the health services they need to thrive in a changing climate. Let us therefore seize this moment, harness the power of collaboration, and unlock the resources necessary to build a resilient health system for all, with equity and justice, leaving no one behind. Thank you very much.
please welcome Pascal Lamy, former Director General of the World Trade Organization and former Trade Commissioner of the European Commission, Dr. Ibrahima Sy, Senegal's Minister of Health and Social Action, and Foreign Policy's Dr. Maisha Alam, for a fireside chat on revealing the evidence for action.
Hi, everybody. It's great to be here with all of you, and thank you so much for tuning in online and being here in person for such an important set of discussions. And we're really honored at Foreign Policy to be partnering with Sanofi on this and Foundation S on this, and to have such high-level representation among our speakers, including the Honorable Minister, and as well Pascal, who's been at the helm of so much of this work. I'd love to dive in, and Pascal, begin with you if you'll allow me. And, you know, we just heard a little bit from the previous speakers, but can you just help underscore for the audience, why is it so critical that at this time political will is mobilized for climate adaptation when it comes to strengthening health systems? And how is it that, you know, this can be done in terms of overcoming challenges related to cooperation and coordination across the globe?
Well, thanks. Hello, everybody. I'll answer your question as both member of this Collective Mind Council and as chair of the Climate Overshoot Commission. We've published our report a year ago. Exactly. And the overall scope of our recommendations covers an agenda which we call CARE, C-A-R-E, cut emissions, adapt, remove carbon, and explore geoengineering, which we know is a more controversial topic. Unsurprisingly, we've devoted quite a lot of time to the impact of climate overshoot into health systems. I don't think I need here to expand on why this is a huge global problem, a totally underestimated by public opinion and held by politicians. So my answer to your question is, what should we do? Not what's the problem. We know the problem. We know the problem is horrendously big and it's coming extremely fast. We have already overshot. And the question is not whether we will overshoot 1.5 or not. The question is, given we are overshooting, after 1.5, are we going to continue? Are we going to plateau? Or are we going to decrease? And this is where we need a full-fledged agenda. We need to decluster the conversations between emissions, adaptation, removal, and geoengineering, which for the moment are in very different constituencies. So in order to raise awareness, and among the terrible consequences of overshooting 1.5, health comes number one. It's not just health, it's food, it's the ocean, it's a whole range of our ecosystems, but health comes number one. So advocacy, let's put the numbers on the table, let's raise public attention. And second, and this is, I think, what many people here, and I recognize quite a lot of friends will not be surprised, I say, let's act in making sure that we care about the last mile. What really matters in health systems is the operational part. I was just discussing with Peter Sands. I've been working when I was DG of WTO on IP-related issues having to do with the Global Fund. If I have one model in mind, and I know it's always risky to have one model, but let me put it on the table, we have to emulate the Global Fund governance operational system in looking about the impact of climate on health systems.
Thank you for that. And I want to pick up on a couple of really important points that you made. The first related to breaking down of silos and not treating these as somehow separate and unrelated. And the other piece being, of course, the funding and financing. And as you will all have seen on your seats, you know, this is one of the key points in the From Risk to Resilience report, and I encourage everybody to take a look at it. But another really important piece relates to financing, and in particular, one of the findings of the report is that in 2022, only about 20% of multilateral funding assigned by the GCF went to projects with health benefits. And that really tells you what a distance there is to close, so to speak, when it comes to these issues. And so, Minister, I'd love to bring you into the conversation at this point and ask you a little bit about the kind of financing that's necessary for achieving that last mile when it comes to climate adaptation of health systems. What are the changes to the global financing framework that you believe are necessary in order to better support the operationalization and the last mile delivery that Pascal was touching on?
Thank you. I think today the most important issue of climate change is how to get funds and to act. And when I take the example of my country, we have developed several documents to integrate climate change in health sector. But the limitation is how to deal with the national budget, because we have a lot of priorities and we have problem to cover the need for climate change. And I think we need to build capacity building of health sector in order to have the capacity to develop fundraise in international fund, but also in domestic fund. Because I know in Senegal you have a lot of societies that could help to mobilize fund. And here today I know that we have the increase of need to have fund for climate change, because we have the need to deal with disease, because when you have rain or flooding, our health services have to deliver. But and this is the most important issues that we have. And we need to develop a clear strategy. And it is not for Senegal, because all countries, all African countries facing to climate change and having limited budget. And we need for this to have new leadership. I think in African countries, we have ministers of health, we have president, but we have not now who could play a role as champion around the world to say that in Africa, our health sector is facing to climate change risk. We could integrate it in policies, in health policies, but we need to have sufficient fund to cover this additional budget in order to be resilient to climate change. And I think for this, all African countries need to have one voice on the access to climate fund to build resilience. And I think that if international community have money, it's now time to act for climate change to support health sector. Because in Senegal, I see that agriculture, livestock, coastal erosion, biodiversity, they have a lot of fund from GCF or GF or other donors. But if you take the example of health sector, you have now any budget for dealing with climate change. But we have now submit a proposal to GCF, and I hope it will get done, and we could have funds in order to build resilience to climate change of Senegal health sector. Thank you.
No, thank you for that, and I appreciate you just so clearly articulating the very real impacts that you're already confronting and the way in which they're hampering the ability for health systems to function. As you know, we're here on the margins of the UN General Assembly. The Summit of the Future is taking place. And of course, COP29 is just around the corner. So just as we close off this conversation, I'd love to ask both of you this question, which is, what do you see as the most important partnerships that are going to be necessary going forward in order to be able to implement the kind of change that we're discussing? So maybe, Pascal, I'll go to you first and then give the Minister the last word.
Well, part of my answer will be in a policy paper, which we, Climate Oversight Commission, will publish on the occasion of the World Health Assembly,
Right.
which is on our road
Yes.
to this year's COP. I think the answer to your question cannot be simple. We need to articulate local coordination, and there's a lot of that to be done. Regional coordination, and the Minister, I think, absolutely rightly front-loaded the African as a continent question, and multilateral cooperation. So just doing this, I think, is complex, but we have to do it. And then I think we have to involve, and this is why I was referring to the Global Fund, we have to involve a multi-stakeholder system. Mm-hmm. We need governments, but most of them are now heavily indebted. And the big ones are stuck in a diplomatic frozen system. So we need other than governments. We need academics, we need NGOs, we need big multinationals. So we need to structure at the three levels a multi-stakeholder platform like. And I think when I look at who's in this room, you are all potentially part of that.
I love that. Thank you. And I think that's a perfect segue, Minister, to you in terms of what kind of partnerships do you think are necessary right now?
You know, a lot of African countries develop now their health national adaptation plan, and they express clearly the need of funding. And I think that in terms of partnership, we can develop the model or the approach of compact in cooperation. And this compact could be function as platform where all partners could say that this is the flow of money that I give to health sector in order to deal with climate change. And it will be more easy for health sector to access to this fund than the facilities as GCF, where it is so difficult for health workers. And I think that all partnership could have one platform where they put all the money that they say this is for dealing to climate change, but only for health sector.
Yeah, I think that's such an important message. Well, Dr. Ibrahima Sai and Pascal Lamy, thank you for sharing your perspectives and for issuing such clear call to actions for all of us to take forward. Thank you very much.
Please welcome Yassine Djibo, the founder and executive director of Speak Up Africa Senegal, Peter Sands, executive director of the Global Fund, and Dr. Monique Vletter, head of health, nutrition, and population at the World Bank, along with our moderator, Anil Soni, CEO of the World Health Organization Foundation, for a panel discussion on unlocking climate financing for local health adaptation.
Hi, everyone. The three people to my right represent almost exactly embodiment of the three recommendations in the report released today. Yassine, given your work of Speak Up Africa in Senegal, I'm going to ask you to speak a little bit about what it means to break silos. What does it mean for local stakeholders who are closest to the challenges and the solutions to have voice in decision-making and governance? How do we make sure you and the people you represent are at the table guiding the funding decisions? And I'm going to go through each of you so you can take a second to think about that. Peter, as the executive director of the Global Fund, which is the world's largest financing mechanism for infectious disease, I think the second recommendation of bridging capacity gaps, how do funder requirements be adapted to meet the needs of climate and health and to push more money to local solutions and local stakeholders, is one that I'm sure you're thinking a lot about. So I'm going to come to you to ask you about that and how mechanisms like the Global Fund are adapting to the needs of the moment. And finally, Monique, I'm going to come to you on the third recommendation. Really, the panel makes it very easy for me as a moderator. on building new funding channels, developing and scaling dedicated funding mechanisms for locally led adaptation. So we have the fund, to Monique's right, and that's important. But the figure in the report, and that we're all talking about, an annual gap of $366 billion for climate adaptation, is well beyond the scope of official development assistance, is well beyond the scope of philanthropy. So the question, Monique, I'm going to come back to you, is say, how do we bridge the gap, particularly given what the World Bank and regional development banks can do? In each case, for the benefit of the audience, we're going to ask each of you to give an example of what's working relative to that recommendation. So give us some hope. Tell us where it's working now, and then help us understand what the gaps are. And given this audience, which is spectacular, what do you need from the people in this room? So Yassine, starting with you, coming back to that first recommendation, breaking silos, how do we make sure local stakeholders are part of the process or at the table? What's working and what more do you need?
Thank you so much, and thank you for having me here. I think what's working is what's happening right now, is having communities at the decision-making tables and part of these important conversations that are happening around shaping the global agenda. If we don't have that, then we are not able to serve the communities that we want to be serving and that we all agree are the priority of everything that we do. I think in terms of breaking the silos in countries, it's also important to have the appropriate mechanisms in place. So looking at ensuring that there's units within cross-ministerial, across sectors, including civil society, youth, and others, that are able to work on the national strategies, including the national adaptation plans, that they have a voice and that we are able to reflect the local realities. I think for me, that's the biggest challenge, is today there's a disconnect sometimes between what happens at the global level, at the regional level, at the national level, and then even within country, there's a disconnect between what happens in the health sector, what happens in the climate sector, and what happens in other sectors. So really trying to see how we bridge those silos is critical. And
Can I double click there for a second? Mm-hmm. The Global Fund is an example of a mechanism in the health sector that requires civil society to be at the table. But in order to solve the challenges of climate adaptation, we have to look beyond the health sector. Can you give us an example of where local stakeholders are part of the decision-making progress beyond the health sector, with a Ministry of Finance thinking about allocations of resources for other sectors?
So I think I was also going to give the example of the Global Fund, because I do think it is a mechanism that can be used to include these other priorities. I think the country coordinating mechanisms work well, are well established. And so if we can ensure that the priorities, from in terms of what we're trying to achieve with climate adaptation are included within that, and I know Peter will be speaking a little bit more about that. And then, there are within the presidency, for example, of Senegal, there's someone who's specifically responsible for all health issues, including how they intersect with other areas. And so that could be a mechanism that could be further developed to be able to have that engagement from all sectors.
Last question, Yassine, for you. Looking at this audience, what more do you need? What are your requests of the people in this room who have power and privilege to implement this first recommendation on breaking silos?
So my request is really to be intentional about including communities in all the different levels of decision making, and really ensuring that there's a co-creation process at the beginning, and not once everything has been agreed upon, then we bring in the communities. And I think it also has to go beyond representation. So to truly take into account what the communities need And that also brings the issue around power imbalance. So really being conscious that there is a power imbalance that exists, and so how do we put in place the mechanisms that will allow for that power imbalance to balance out and to be really inclusive of everybody.
Thanks, Yassine. Peter, your leadership of the fund, you've had to adapt the fund to be responsive to pandemic challenges, response and preparedness, now climate and health. How are you adapting the fund, you and your team, to the needs of climate and health, including the needs to put more money into the hands of local stakeholders?
Right, well, let me start with some of the things that, in a sense, are okay or going well. One good starting point is that of the $5 billion or so the Global Fund invests every year in health, 70% of it goes to countries that rank among the top 50 in terms of climate vulnerability. Now, that's not because we had great foresight about which countries would be most climate vulnerable. What it actually reflects is that the people who are most vulnerable to infectious disease also happen to be the people who are most vulnerable to climate change. So that's really a bad thing. These are the people who are being impacted by the kind of double whammy of both. But what it actually means, the good thing is that we are already focused on those communities. I do think we can use, and we are using, established mechanisms, the country coordinating mechanisms, the inclusive decision making in those responses. And one of the things that was quite interesting to us was that in the last grant cycle, in the funding requests, 40% of them included components related to climate change. And we really hadn't asked for that. It was coming from the countries themselves. And that, to me, is an indication of the system itself working. What isn't working? Well, there isn't enough money. Let's be clear, on malaria, which is one of the most climate-sensitive diseases and where the epidemiology is being changed quite dramatically, there isn't enough money in the first place, even before climate change. And we're not going to solve the problem by just diverting money that wasn't enough before. So we are going to have to raise more money. And one of the things that actually just happened at the end of August, the Global Fund Board approved climate and health as a catalytic priority, which means we can go and raise money specifically for that. And as you might guess, we are doing that. We are very actively doing that because where we sit at the moment, even though we are investing in flood resilience, because we're spending a couple of billion a year on health systems, we're investing in things like flood resilience, disease surveillance, linking meteorological data, making supply chains more flood resilient. It's not enough. We have about 400 to 500 million right now in specific requests from countries for climate-related investments I have no money for. So we need to go out and get more. Reflecting on some of the key barriers, apart from the insufficient funding, which is pretty obvious, local knowledge undervalued. I actually think we are going to have a very inclusive to and fro process as we adapt. There's a lot of questions about the impact of climate change on health none of us know the answer to. And we need to be real-time learning. We can't wait to act, but we've got to be real-time learning as we act. I do think the thing about power imbalances is incredibly important. I thought the global health world was a technocratic, top-down world. Then I met the climate change community. The climate change community makes us look very sort of inclusive. And, we do need to ensure the voices of communities, and not just the voices, but the leadership and the active engagement runs through the whole process. And then complex processes. The one thing I can promise people is if they want climate change money through the Global Fund, it will be exactly the same complex processes, but at least they're not new complex processes. We are running all our stuff on climate change through all our existing reporting assurance and things, because we know that the last thing countries need is a completely different set of things. Last thing I would mention is one part of it is about preparedness and resilience of systems and anticipation. The other part of it is about responsiveness. We have been using our emergency funding more than we ever anticipated because of the frequency of floods and cyclones, flooding in Kenya earlier this year, the flooding in the Sahel right now. And this money can arrive very, very quickly and is useful. However, to my mind, we should be learning from the fact that if you're using emergency funding for the same kind of thing all the time, then you're kind of missing the point. There's a pattern here, and there's a bigger problem that we've got to solve. And that is why our board has decided to make this a focus and a priority.
Thanks, Peter. You mentioned in the emergency funding something that comes up in this third recommendation. And Monique, now let me come to you. But this third recommendation, it is once again a important list of where else can the money come from. Emergency response funds, catastrophic insurance, innovative finance. But ultimately it comes down to how do we bridge something of this enormous gap of finance. Monique, you're at the World Bank. Your capital can be used differently and that of the regional development banks than ODA, than grant capital. Help us understand what you're doing to bridge this enormous gap of capital finance.
Great, thank you so much. Really great to see this kind of interest in this important topic. Maybe I'll say a few words about the shift we've been making over the last 2 years at the World Bank, and then talk very concretely about some country examples so that you can really visualize how we see the climate and health agenda moving forward. And so our president, President Banga, came in 2 years ago and made an important switch, and it might seem minor to you, but he added the language to our vision statement. And instead of saying our goal is a world free of poverty, he said our goal is a world free of poverty on a livable planet. And that actually led to very major changes in the way we organize our work, how we focus, and also in terms of our financing. And so he then set the goal that 45% of all World Bank financing, not just for health, but for all sectors, should be climate related. And we really in the health sector saw that as the opportunity to say, well, in actual fact, this is a systems agenda. It needs an integrated approach, and we want to take the portfolio of programs that we have and our collaborations with 110 countries in the health program of the World Bank to go through this transformation and ensure that everything we do on health takes into account climate as a factor. And so how do we do that? And I just came from 3 conversations with 3 different country ministers, very inspirational: Sierra Leone, Mozambique, Nigeria, all struggling with the same issues. And we start with working together under country leadership to do an assessment through a diagnostic tool that we developed of what is the biggest impact of climate on health. And it's very, very wide-ranging, right? It's not just extreme weather events. We are seeing outbreaks of cholera. We're seeing increases in other diseases. We're seeing a real pressure on health workers to be able to be responsive. But we're also seeing people struggling to access services because they need more of it and they don't have the financial resources, and they're making really difficult choices between buying food for their families or buying medicine or accessing services. And so it's a wide-ranging agenda, and for us we can only fully respond if we ensure that the work we do on primary healthcare reform, on financing, on human resources fully takes into account the impact that climate is having on health. It's also a multi-sectoral agenda, and so, for example, the 21 countries that are struggling with waterborne disease outbreaks because of the changes in temperature, you see these outbreaks happening in communities, in those communities that are most marginalized and also don't have access to clean water. And so in collaboration with WHO and with our water colleagues in the World Bank, and we can actually target the water finances, resources towards those communities that are most affected in their health outcomes because of climate. And this is just one example. There are many other examples of how we sort of leverage that multisectorality across the bank. And I was very inspired listening to our first panel member here. I really fully agree. When I think about country leadership and voice, we have to take full country voice into account. And you know, I want to finish with making one more point there, that it's really not the same for all people, right, the impact. And so if you look at the impact on women, if you look at the impact on poor people versus rich people, it's not the same. And so in how we design and how we use our collective leadership, we really need to take into account that these resources first and foremost need to be focused on those people most in need. Thank you.
Thanks, Monique. We're going to finish up, and I know we're short on time. I'm just going to end by reflecting back on something Peter and I were talking about before we walked in, which is what's the effort to outcome ratio of meetings like this. Many of you are not living here in New York. You've come to New York for this week. You attend sessions. You speak at sessions. I think it's incredibly important, as Monique just ended, to say, if you have not seen with your own eyes, or if you are not someone who lives in a setting in which this is happening right now, please trust it is absolutely urgent. I was back in India for the first time since the pandemic a few weeks ago, and I met women who live in Gujarat where the temperature inside their homes is exceeding 50 degrees. Already. And thankfully, there's now an insurance product this year. 50,000 women had access to cash payouts when the temperature hit a certain level so that they could adapt. But that's 50,000 women out of billions of women who are affected by climate today. So this is urgent. And so my challenge to each of you is, one, hold people in power accountable, including everyone on this stage. And second, make your own intention, as Yassine, that beautiful word that you used, of what you're going to do differently this week, because it is urgent, and it is the time right now to act, as we heard earlier. Thanks very much.
Please welcome to the stage Holly Ranavuzanani, Deputy Executive Director of the Africa-Europe Foundation.
Well, it's always hard to come after such a great list of lineup of panelists. And of course, especially what they say is exactly what I wanted to say. So hard to be here. But I think today's conversation was really a testimony about the real need for change and for action. So we heard the data. We heard the challenges. We heard the stories as well. We heard from countries. But what we heard more importantly is the will for greater ambition to accelerate really this progress and ensure that our climate action today benefits the health and well-being of the most vulnerable communities. So as clearly stated in the report, there's not enough money being invested to support climate resilience and sustainable health systems. Vulnerable countries required hundreds of billions annually for climate adaptation, far surpassing current funding levels. Less than 5% of climate adaptation finance has been allocated to projects and programs that protect and improve health. Of course, money matters, but it's not just about the money. It's also about people's life. It's also about people's future. So we at the Africa-Europe Foundation, we really see the Africa-Europe partnership as that essential framework to really foster this cooperation in climate resilience and health. We work with partners across both continents to support more ambitious, more transparent goals as well that reflect the urgency of the crisis that Anil and the other partners just reflected on. So what we want to do is really look at different solutions, calling for leveraging innovative financing mechanism, because we know money is definitely not enough, from resource mobilization, including illicit financial flows, carbon markets, to blended finance and as well SDR allocations, because we are at an inflection point and we need to advance. We, of course, remain committed to work together with different governments, private sector, multilateral institutions, civil society, to really make sure that we drive the financial commitments, but beyond that, really address, of course, these pressing challenges of our time, which is also a health equity issue. So this week, of course, we're happy to be in New York. There's a lot of energy. But if we have learned something over the past few days on the Pact of the Future, of course, being adopted, is that we have a shared and common future that demands action now. So this is why, with all the partners, with all of you here around the table as well in the room, we really look forward to drive, shape, and seize this leadership collectively to ensure climate resilience to those who need it the most. And of course, as we say, it's not just about a conversation today. This is a journey. So looking forward of maintaining the momentum, bring the dialogue, making it to action towards a full COP29 and beyond. Thank you.
Please welcome Foreign Policy's Andrew Solinger.
Thank you, Holly. That was great. And thank you, Foundation S and the Africa Europe Foundation for convening us all today. What a great discussion. We learned so much. I won't recap. It was a lot to take in. I think it was fantastic. That concludes our program for this afternoon. I said afternoon earlier. Now it really is afternoon. We are going to break right now and reset the room. So I'm going to politely ask that everyone andiamo into the section where we can network. I might also ask very politely and respectfully, if you didn't register for the afternoon health forum, we're going to kick off our program again in half an hour. Some of you may have registered for that. Please do stay. But if you didn't, we have a lot of people downstairs waiting to get in. And as you can tell, we're at capacity. So it's a one-for-one kind of arrangement. So I ask respectfully if you could watch our excellent live stream. There are no polls in the way, so you can still enjoy the programming. Thank you so much for coming. We'll see you soon.